welcome to our show, Health and Wellness, Myths versus Facts. The endocrine system is a network of glands that produce and release hormones. These hormones are responsible for various functions in the body, from heartbeat to tissue growth to the creation of new life. Diabetes mellitus is one of the most common endocrine disorders that affects the body's ability to produce or use insulin. Worldwide, 537 million adults are currently living with diabetes. The number of people with diabetes in India is the second highest in the world. Over 77 million adults are living with diabetes in the country, and the worst part is that diabetes in India starts at a relatively young age, almost a decade earlier than in Western countries. Early onset of diabetes increases the risk of associated complications. Education is one of the most important components to ensure better management and control of diabetes. There's also evidence that improving knowledge about diabetes and its complications has significant benefits, including increased adherence to treatment, thus a reduction in complications associated with diabetes. There are many misconceptions about the disease, prevention as well as management of diabetes. It's only by raising awareness that we can help everyone else to understand what we live with. In our program, our experts provide medically accurate and actionable advice on preventing diabetes and help viewers identify strategies for long-term control. So let's just talk to our doctors. We have Dr. Jacob, Professor and Head of Endocrine and Diabetes Unit at Christian Medical College and Hospital in Ludhiana. We also have Dr. Madhu joining us. That's the Director and Professor, Department of Endocrinology, Center for Diabetes, Endocrinology and Metabolism, the University College of Medical Sciences and JTB Hospital here in Delhi. A very good afternoon and thank you so much for joining us here on the program. Let me take my first question to Dr. Jacob. What are the target values for blood glucose levels for the management and the treatment of diabetes? Does the presence of diabetes complications and other comorbid conditions affect these target levels? Dr. Jacob.
Thank you for inviting me to the program. I think with chronic diseases, we don't believe that the absence of symptoms is what is achievable. I mean, your organs are still getting damaged even when you don't have any symptoms. So that is why we have targets. And these targets, what is traditionally accepted for preventing long-term complication is to use a test called HbA1c or glycosylated hemoglobin, which usually tells us what the sugar is like for the last 3 months. And using that, we target it to between 6.5 to 7%. Saying that, I think you should remember there are some caveats. One of the caveats is that if you're a younger patient with longer life in front of you, you can try and achieve HbA1cs as near to normal as possible if it is achievable without too many side effects of the drug, if it is achievable without too many hypoglycemic episodes. Now, the second part of the question is if you've already developed comorbidities, or that means you have already developed some of those complications of diabetes, then you need to be a little more relaxed because you are not now preventing complications. You have already developed them, like patients with heart failure, patients with chronic kidney disease, patients who have a limited life expectancy. We relax targets. We keep it 7.5, even 8 is acceptable. Somebody who's at the end of his life, even patients with where we control the sugars just to control symptoms is more than enough. So I hope that answers that question.
Right, it totally does. We also have Dr. Verma, endocrinologist, Harsha Diabetes and Endocrine Clinic from Bhima Verma joining us this afternoon. Dr. Verma, let me take my next question to you. Many people with type 2 diabetes are asymptomatic. When do symptoms start appearing in these patients, and what are the recommendations for type 2 diabetes screening in asymptomatic adults? Dr. Verma.
Yeah, thank you for having me. See, as you already told, most of the diabetic patients that usually develop in the early parts of the disease, they are usually asymptomatic. And the symptoms that they develop usually depend on the glucose levels at the point of interaction with us. And usually at around early stages of diabetes or pre-diabetes, they are asymptomatic. And they usually develop excessive thirst, weight loss, slight blurring of vision, or some foot pains or tingling and numbness in your foot. And if you come to the screening part of this, screening for diseases is again an important part. So because the burden of diabetes is such high that If we don't diagnose them properly, then the risk of getting complications is very high. And screening, it usually is advised for all adults who are obese or who are overweight and have some form of risk factors like, say, dyslipidemia, hypertension, a CVD, or a close relative who is having diabetes or who is physically not having a significant exercise regimen. So those people are at high risk and they do require constant screening. If we consider asymptomatic adults, then usually we start screening after, say, 35 years of age. And again, continuation of the screening, it depends either yearly or 3 yearly, depending on the risk profile of the patient. And this screening we usually do by either doing a fasting glucose level or 3 months level, that is the HbA1c level, or OGTT, that is doing glucose testing after giving 75 grams of glucose. So by this screening, we can find out whether the person has diabetes or not. Thank you.
Right. People talk about uncontrolled blood sugar. What exactly is meant by uncontrolled blood sugar levels? When should a person with diabetes start to worry about his or her uncontrolled blood sugar levels? Dr. Madhu, if you could answer that.
Thank you. When the blood glucose values in a diabetic patient is above the target range, and you've heard the targets from Dr. Julian, if they're not in target and they remain out of target for a sufficient length of time, then we generally refer to that condition as uncontrolled sugars in a diabetic patient. The patient obviously needs to worry about the sugars if they continue over a length of time and needs to get them under control. Firstly, he needs to check on his lifestyle measures, the diet, as well as the exercise adherence. And if not optimum, he should optimize those. And if the sugars remain uncontrolled, then he should visit his physician, because only then some alteration of treatment may be required to bring that glucose under target. And depending on the age, and you've heard Jobin telling you about the targets in different age groups. Now, if you don't have the glucose levels in target, or the HbA1c remains out of range for a length of time, that is the problem. And that is what leads to several complications in the long run. And the whole purpose of treating a diabetic patient is to prevent those long-term complications.
Right. So if you're living with type 1 or type 2 diabetes, continuous glucose monitoring can help you make more informed treatment decisions that can lead to better glycemic control. At which stage of diabetes is it considered for use, and is it necessary for all people with diabetes? Dr. Verma, if you could answer that.
See, this CGM technology, that is nothing but continuous glucose monitoring systems, they have come up in the last 3 to 5 years, and they have been quite helpful in treating diabetic patients. See, the advantage with CGM is it gives a quick at a glance glucose reading, and that too continuously for up to 14 days. So what we do is we usually keep a small sensor of about, say, a 1 rupee coin size sensor on your arm, and that continuously measures your glucose level for up to 2 weeks. So the advantage is we don't require to continuously prick you to get your glucose levels. And this technology, though it is new, it has been quite helpful. And again, it at the starting stages of its development, and we do require some more research on this to give it to almost all the patients. But till now, the data that is available shows that it is quite advantageous, and it is necessary for type 1 diabetics who are on multiple insulin injections. So it is definitely helpful in them. In type 2 diabetes, again, the persons who are taking insulin, it is definitely helpful in them. And apart from these two categories, like some special categories, like people who are unaware of their hypoglycemic episodes, like who are not able to detect getting low sugars, those type of patients, again, they will benefit from using this CGMS technology. And again, special populations like elderly who are more prone for glycemic variations, they can be helpful. They can get help from this technology. And again, pregnant patients, also where frequent monitoring is required, they might benefit from this technology. And not only that, for normal common diabetic patients also, if they are more into, say, exercising or in the athletic side, and they want to monitor their glucose levels after each exercise episode or if after each workout, then definitely this will be much helpful to them, and its use will definitely increase in the next, say, decade or 2 decades or so.
Right. Regular physical exercise is a major part of diabetes management. When is the best time to exercise for people suffering from diabetes, and what type of exercises are safe for people who might be suffering from diabetes? Dr. Jacob.
Yeah, so the best time to exercise is the time that is best for the patient to exercise. So whichever time they are willing to exercise, I think that is the best time. But if you ask me in terms of what is the best time which will lower your glucose, the answer to that is 1 to 3 hours after a meal. But you have to remember, if you're on insulin, if you're a type 1 diabetic, this is the time where also you are at maximum risk of hypoglycemia if you exercise after a meal, especially if you exercise, say, after dinner, you are at risk of late night hypoglycemia. And that is the reason I would recommend for most patients who are on insulin or glucose lowering drugs, they preferably the best time is probably 7 a.m. before breakfast. And I think that is what you should stick to. The second question was, what are the types of exercises? I think moderate intensity physical exercise like aerobics, walking, swimming, these are, I think, essential. About 150 minutes in a week is essential. The other types of exercise, that is resistance exercises, which includes weightlifting, using a weight machine in a gym, these can be added. They have benefits over and above aerobic exercises, maybe 2 or 3 times a week. And lastly, flexibility exercises. And this is something people are fond of. Yoga. I think this is again something that can be added on to the other two. And about 2 to 3 times a week, I think you should add flexibility exercises as well. I think in the minimum aerobic exercises, 150 minutes a week. But if you can add flexibility and resistance exercises, I think that will be best.
Right. Now, people with diabetes have an increased risk of developing a number of serious health problems. Which are the most serious and life-threatening complications associated with diabetes? Let me take this question to Dr. Madhu.
Thank you, Divya. There could be several complications, both in the short term and in the long term, and some of them could be really serious and life-threatening, and we need to know about them. In the short term, the blood glucose levels, because of various triggers, could get into excess of 400, 500, or even more. And this can be associated with some kind of dehydration, unconsciousness, and even death, and become very life-threatening. We call it a hyperglycemic crisis. And this could be a result of infection, stress, or any other trigger. And this is in the acute. Apart from this, you could have infections. So we all know that infections are quite common in diabetic patients, and any of these infections have the potential to spread to the bloodstream and become really severe and life-threatening at times. And we even seen COVID causing excess mortality in a diabetic patient. Apart from this, talking of heart attacks is again an acute life-threatening condition, which is much more frequently seen in a diabetic patient. It's much more serious, many times silent without obvious pain, and could straightaway end up with complications and result in sudden death. And therefore, it's life-threatening, and we need to always be alert to the possibility of heart attack. In the long run, I think diabetic kidney disease is one of the long-term complications which results in death. And although it's a long-term complication, it could suddenly result in kidney failure because of any more triggers, and finally become life-threatening of its own. Complications like, let's say, diabetes gangrene, although usually is only limb-threatening, can also become life-threatening if the infection spreads or the gangrene spreads, and the patient can lose his life. So there are several complications, both in the short term, metabolic as we call them, or in the long term related to the heart, kidney, or even the foot, which can become life-threatening. And that's the reason why we tell all patients to have their sugars under control, have their associated lipids and blood pressure under control, and be free from the risk of life-threatening serious complications.
Right. So with that, we're taking a break on our show, Health and Wellness Myths versus Facts. Our expert panel of doctors will be joining us on the other side of this very short break. Stay with us. Welcome back to Health and Wellness Myths versus Facts. We have Dr. Verma, Dr. Jacob and Dr. Madhu with us. Let me take my next question to Dr. Verma. Why do people with diabetes feel tingling in their feet and legs? It sometimes feels like pain from pins and needles and they hurt a lot. This occurs mostly during the evening and at night. What is this condition called and how can one protect and manage this? Dr. Verma.
Yeah. Yes, Deepa, this is the most common complaint with which a diabetic patient comes to the doctor. Mostly pins or needle sensation or tingling sensation. This is a quite common condition called diabetic neuropathy. What happens is that when the nervous system gets exposed to a chronically high glucose levels, it gets damaged, leading to this neuropathy. The patient can either complain of, say, tingling and numbness sensation or burning sensation, or some of the patients can have a complete loss of sensation or painful sensation to a simple touch also. And this, along with diabetes, having a poor lipid control or a high blood pressure levels, or say if the patient is a chronic alcoholic or a chronic smoker, or if he's having some other vitamin deficiencies, again, these neuropathic symptoms are exaggerated. And if you consider this neuropathy also, there are several subtypes of this. So the most common thing that we usually see is a sensory neuropathy, in which the nerves affecting the sensory organs like, say, touch and temperature are affected, which leads to this tingling sensation. And apart from this sensory neuropathy, the other things are like, say, motor neuropathy, in which the nerves affecting the muscular actions are affected, leading to muscle weakness. Or the other form of neuropathy, which is the most dangerous form, is the autonomic neuropathy, in which the nerves affect the involuntary actions of the body, say like digestion or heart rate, those are affected. So even though these neuropathic symptoms are, say, not that concentrated by the patient, these are quite serious and can lead to quite devastating consequences. And if you come to prevention of these neuropathic symptoms, see, the single most important thing that the patient can do is controlling his blood glucose levels. If the blood glucose level is perfectly under control, then the progression of this neuropathy is halted. And apart from this, if the other things that the patient can do is have a good balanced diet, a good exercise regimen, having good footwear to wear, and correcting his vitamin deficiencies, stopping alcohol and stopping smoking are the other things that the patient can do. And apart from this, every diabetic patient should get their neuropathy tested at least yearly, if not more, depending on the patient condition. Thank you.
Right. So what is glycemic index? What determines whether a food is, say, high or low in GI? Dr. Jacob.
Yeah, Divya, all foods that we eat, if it contains carbohydrate, is going to get digested and going to get converted to glucose. So this glycemic index is what we call, it's a value from 1 to 100, which we give for a certain food, and it looks at the amount of glucose it can rise up after 2 hours of consuming this food. So we have foods which are called high glycemic index food. Those are above 70. Let's say someone consumes pure glucose, that is going to get completely absorbed, and that's got a glycemic index of 100. If there is a food which has absolutely no carbohydrate in it, it's got a glycemic index of 1. So high glycemic index foods are the ones which are above 70. Low glycemic index foods are the ones which are below 55. Most of our fruits and vegetables, nuts, pulses, they are all low glycemic index. White bread, white rice, cornflakes, these are all high glycemic index food. Saying that, I think glycemic index in itself is not the most important thing. It's also the amount of carbohydrate that is present in the food. You may have things like ice cream, which actually has a low glycemic index, but we know that it can push up glucose because it has a lot of carbohydrates in it. And the other caveat to remember is these are arbitrary values. So if you cook a food, the glycemic index is going to change. The same fruit, if it is half ripe, it's going to have a lower glycemic index. Now it is overripe, it's going to have a higher glycemic index. And then if you eat processed food, that's also going to increase the glycemic index. So I think these are some things you have to keep in mind when you think about glycemic index of certain foods.
Right, so we spoke of glycemic index or GI, but what is GL, glycemic load, and how does it affect blood sugar levels? Dr. Madhu, if you could answer that.
Thank you. I think Dr. Jubin explained very well the concept of glycemic index, and it's just the concept which has been extended a little more to make it a glycemic load, to try and assess the load that these glycemic index foods would have on the body and what the patient will need to handle. So it's just multiplying the glycemic index value of a particular food with the amount of, let's say, carbohydrate that you would take per serving in a particular meal. So broadly, it's the load due to the glycemic index of a particular food that is there on an individual, which he needs to handle, a diabetic patient particularly, in terms of not allowing the blood glucose levels to rise or easily control them. Now, because this is what tells us the patient need to handle, it's an important concept to understand beyond the glycemic index, which, as you heard, can change depending upon the processing, depending upon the cooking, and many other factors. Now, in general, if we consume larger amounts of low glycemic index foods, some of which Dr. Jubin mentioned, and if we consume smaller amounts of high glycemic index foods, that would keep our overall glycemic load under check. So that's the overall goal. Now, if we want a diet with lower glycemic load, we need to focus on consuming more of whole grains, nuts, legumes, fruits, particularly the low glycemic index fruits like guava, papaya, apple, and even sometimes even unripe banana. Vegetables which are non-starchy, they would have low glycemic index, as has been said, and other foods also which qualify as low glycemic index foods. We need to have smaller amounts or fewer amounts of high glycemic index foods, particularly potatoes, white bread, processed foods, sugary foods, candies, chocolates, sweet drinks, cakes, all of these which were mentioned also by the other panelists. And if we are able to balance these two in our diet, the load of carbohydrate in a particular meal would not be high or would not tend to raise glucose levels very fast, and that would help maintain reasonable control of our blood glucose values as we attempt to control them by drugs, by diet, or by insulin.
Right. Thank you so much, Dr. Madhu, Dr. Jacob, and Dr. Verma for joining us on our show, Health and Wellness, Myths versus Facts, here on NDTV. I'm afraid that's all the time we have today. Thank you so much for tuning in.